And we'll do sort of introductions of why we're here and what our plan tonight is. But first, I'd like to introduce myself and my co-chair, and then ask the other Health Services Impact Committee members to introduce themselves. My name is Lois Wessel. I live in Tacoma Park. I'm a nurse practitioner, and I work in a variety of community health settings.
My name is Drew Summers. I'm a medical sociologist. I work for the Congressional Research Service.
And I'd like the other members of the Health Services Impact Committee, I think there are 4 here, am I missing anybody, to stand up and introduce themselves as well. And is it okay that they are introducing themselves without the mic? Oh, got to go over to the mic. I think Seth's got it.
Okay, my name's Trevor Delafield, and I'm a retired associate pastor at the Tacoma Park Seventh-day Adventist Church, and I'm serving as a member of the Health Services Impact Committee.
My name is Patty Lovelace, living here in Tacoma Park, peace and social justice activist, and I live here in Tacoma Park on Maple Avenue. Next.
Seth Grimes. I live on Willow Avenue in the Philadelphia Eastern neighborhood. I'm also president of the Old Town Residents Association.
Hi, I'm Fred Hofflinger. Can you hear me? I'm not sure where to put this. Okay. I live in Tacoma Park on Davis Avenue. I'm a CPA. I work for the Medical Assistance Administration in D.C. That's Medicaid in D.C.
I'm Vanita George, City Staff Liaison to the committee.
We're also very pleased tonight to have 2 council members from the city, Reuben Snipper and Colleen Clay, as well as Kathy Porter, the mayor of Tacoma Park. Oh, I'm sorry, Terry, I didn't see you. Terry Siemens, and I think his wife, right? Mrs. Siemens, am I correct? As well as a variety of people from Adventist Hospital, and I'll let you introduce yourself so I don't get your titles wrong. And Vanita will pass the mic. You can go ahead and start, Jerry, since you have the mic.
Hi, I'm Jerry Stockton, the president of the hospital.
Hi, I'm Robert Jepson.
Jeff Morgan, vice president of the hospital.
Great. As you probably all know, the Health Services Impact Committee was formed by the City Council in Tacoma Park to look at the impact that the plans for departure Washington Adventist Hospital would have on the city, and what kind of services the city would like to maintain, and what kind of services city residents would like to have. To that extent, the Health Services Impact Committee is holding a series of community forums, this one being the 3rd. We had our first forum at Tacoma Towers, which was an interesting experience because for those of you who know Tacoma Towers, it's subsidized senior citizen housing with people who all have, this is the 3rd, Victory Towers, sorry. Used to be, okay, Victory Towers. All older folks with chronic health problems and on fixed income, and so we heard from them what their needs were and what their use of Washington Adventist and other hospitals were in the area. We had another meeting held here at the in this building, where we heard from some more people about what they thought the needs of people were in Tacoma Park. And this is our 3rd and perhaps most important meeting, because since we have been together as a group, we have not known where or when Washington Adventist Hospital would be departing Tacoma Park, and so it made our job somewhat difficult in the sense that we wanted to say what should be left there and what the city residents need, but there was no exit strategy, shall we say. And since our last meeting, Washington Adventist Hospital has secured a facility in the White Oak neighborhood and has also made some commitments to keeping some kind of facility here in the community. And so what we'd like to do tonight is hear from Jerry what the plans are, both for the new facility, and I think more important, what are your ideas in terms of what should remain in place, both with the Long Branch Center, which you can describe where that's at, and the actual facility here. We've thrown around words like urgent care or emergency services. I think some of us on the committee have not always understood what is urgent care versus an emergency room, a freestanding health clinic. Maybe you can talk about what you see the vision as and where you want to continue to partner with the city to hear from us what the needs are. and we'll try to keep, Jerry can talk about a lot of things for a long time, and we'll keep it sort of short, because the reason why you all are here, as opposed to just a committee meeting, is we really want to hear from you, and we want Jerry and the other folks from Adventist Healthcare to also hear from you about what you think the needs in the city are in terms of healthcare. And so when you do speak, you'll be asked to come up to the mic, state your name. If you do represent an organization, state that as well.
Well, thank you, Lois. I appreciate it. I'm going to go ahead and just kind of stand up. I think it might be a little easier for me to.
I need to turn that on.
It's not on right now.
I don't think so.
No. There we go. Now it's on. Okay. I think it's going to be a little easier for me to probably stand up and address you. I don't like standing sitting behind a table, but I do appreciate the opportunity to speak tonight, and I really appreciate the Health Services Impact Committee for inviting us to come and to talk about what's going on. But primarily what we're here to do tonight is to listen to you and begin that dialogue process to determine what's in the best interest for the Tacoma Park and the surrounding communities, and what would you like to see at that location? What do you think is important to you for that location? What I'd like to do is also take Lois's advice and not spend the next 30 minutes talking to you, but maybe take just 5 or 10 minutes getting this up to speed together. And if I may just stretch back for a moment and go back to the year 2000, I think that would be a good place to start. And I'll just quickly go through some history with you. As you know, the hospital went through a process for a number of years to determine what was the best thing for the hospital to do to best serve the communities. And there was a number of years went by where there was a lot of discussion about what is the appropriate thing to do. I think early on in 2000, there was a realization that the hospital needed to modernize. There needed to be some significant investment. There needed to be an expansion. There was a major lack of medical office space in the campus. And really, it didn't really have an ability to grow and develop with the needs as things were changing all around us. I think some great dialogue took place in the community, a lot of discussion. And sometime in the early to the mid part of 2005, actually an agreement was formed between the several folks in the community representing the interests of the community and the hospital related to what really makes sense to go on this site. And I was very pleased, and I thought that a lot of good discussion had ensued. I think some relationships had formed and developed. And as we went back and began to study that, I think what it did for us, it really allowed us, and I think the community can take a lot of credit for this, that it really made us think about not a 10-year future or even a 20-year future, which was somewhat of the historical perspective the hospital had taken. In fact, if you look at the current site, about every 10 or 15 years, some construction project would take place. And you can reach back, many decades, and you can see that as a result. Every 10 or 15 years, something would happen. And so what we did, and one of the things that the community said, don't just think in terms of short term, think long term. What's your long-term strategy here, folks? Let us know. And I thought that was an excellent question. And so we took about 3 months to really analyze what is in the best interest, long term, how to keep the hospital viable and how to make sure that it's compatible with the community. And at that point in time, we made a decision that we needed to relocate the hospital. And you've seen this printed many times. We've talked about it many times, the access issues to the campus, 2-lane roads, the fact that it's a very small footprint. The buildings need to be renovated, and it actually became apparent to us that the best way to have 21st century healthcare and to think about the needs of the community, not just here in Tacoma Park, but really the entire service area that we take care of, was to indeed find a location that would really give the hospital a future for the next 100 years and not just think about the next 10 years. It was a tough decision, and I think everybody kind of went through a really tough time working through that decision-making process. But very pleased that I think it made a lot of sense. I think the community understood it, And we went through a process of announcing that in late 2005. And about a year and a half later, a couple of weeks ago, we announced that we have acquired a property up in the White Oak area. We're very pleased about that. The site is 48.8 acres, and it's off of Plum Orchard Road. I don't know if anybody has a good sense of where that's located, but if you go up, there's a couple of ways of getting up there, but if you go up 29, you can turn right on Cherry Hill, and then you can make another right on Plum Orchard, and it's right, there's a fairly large area right through there that is undeveloped right now. In fact, if anybody shops at Target, it's actually, there's a strip shopping area, and there's a Target, there's a grocery store, and there's some restaurants along there. And what's, I think, very exciting about it is that it's got great access, it's got room for the future development, and I think most importantly, it really does give the hospital a future to continue serving well into the next century. And again, we're extremely excited about it because I think it really does promote better access. It's going to give people more opportunity to access care, and we can talk more about that. But we're just very extremely excited about it. So if I could, I'd like to kind of point my attention back to Tacoma Park for a moment. First thing I want to say is that this is a long-term process. The hospital is not going to construct a new facility tomorrow. It's going to take a number of years to go through the regulatory process, the design process, the construction process, and then eventually the hospital will open. And really, at this point in time, it's probably too soon to really go into details about when we think the hospital is going to open, because there's just so many different things we got to go through. A big hurdle, though, was overcome recently by acquiring the property, and that was big. I mean, that was really important, a very important first step in making all this happen. But as far as us operating here at the Tacoma Park site, for a number of years we're going to be here operating. We're going to continue making investments into this campus. We're going to continue making sure we have modern equipment. We keep the facility working as a high-end tertiary hospital, and we're pleased about that. But eventually the hospital will be gone. And so what we want to do, and we're very excited about, is having a very proactive dialogue with the community and working with you very closely to determine what should be on that campus, what healthcare services should be there, which we've talked about in the last few weeks, what other services should be there. I think there's a wonderful opportunity right now for you folks right here that live in Tacoma Park and those beyond Tacoma Park to vision, to create something that truly is remarkable, that other people in other communities across the country can look at and say, wow, you know, the community collaborated together and they came up with services and functions that are really great for the community. And that's what we want to do. Right now, as far as we're concerned, it's really pretty much a blank sheet of paper. And we went through this process. If you recall back originally, we had talked about actually divesting of that campus and leaving Tacoma Park entirely. But as we went through the process the last year and a half, we determined that really it makes more sense for us to retain that site, to make sure that we talk together about what healthcare services are required there, what do you need, and then thinking more globally about what other things can be there. What other things that should we be thinking about having at that site that really best serve the community? And there's been a lot of thoughts about that. And what we're here to do tonight is to begin that dialogue process. We're not going to solve it all this evening. We're not going to say, okay, you know, here it is, let's submit it. Because I know you're not going to be in a position to do that, but what we are hopeful for is that you will begin that process of really critically thinking about what it is that you want, what is needed by the community, and how can we best deliver that. And we're going to need your help through the process. Some of the things that you may want to do may require some regulatory changes potentially. I don't know, but we're going to have to work through that together. And I think as we come together on a plan that we can all embrace, I think it's going to have a lot of strength, and that we'll be able to go to a larger community, Montgomery County, and say, you know what, this is what we want here. We think this is what we can support. And I think together, if we work together very closely, we can make that happen. So, Lois, Andrew, I'd love to open it up for any questions that the folks may have.
Maybe just one more thing, Jerry, before we get to questions, is if you could update us on the facility that is somewhat related to or it's kind of got rolling with the plans to leave Tacoma Park, and that was a urgent care center on Arliss and Flower that I know has been tied up in some legal issues with the community, and I think that's a good start because I think that's connected to the actual campus. And then
Yes.
we'll go to questions.
Lois, that's an excellent question. Long Branch. And Lois is correct. Long Branch is something we've been focused on now for a couple of years. And it is tied up right now in some issues related to what people think ought to be at that location. One of the things that's very clear to us, and it's been talked to us a lot by the county as well, is that there's something called the Primary Care Coalition, and there's a plan on the table from the county on to create access points of care around the county. And we have made commitments to that. Various hospital providers have made commitments to make sure that we have these access points created. We believe, and if you look at the ULI, the Urban Land Institute, and the Primary Care Coalition studies, is that the Long Branch location is a critical location to have primary care access, as well as there's a real economic development need in that community as well. And it's been many, many years since any private investment has gone into Long Branch. I've heard numbers as much as 25 and 30 years since there's been a purely private development project in that community. I think the last major project there was the community center, if I'm not mistaken. And of course, that's public funds that created that, which is fine. It's great. It's fantastic. But there needs to be a plan for economic revitalization. And a lot of people have said, you know what, this is the right thing to do. The county has said that, and many others. And from our perspective, we think it's important to have a primary care access point. People have said, well, wait a minute, now the hospital, when the hospital moves, why don't you just reuse some of the hospital for that? And certainly that's a logical question. But realizing that we're a number of years away from that happening, and then we've got a plan together, we're working through the process of how do we transform the campus. It could be several years before we can adequately provide a clinic and operation on that campus. In the meantime, people need access now. I mean, this clinic should have been constructed a year or two ago, 3 years ago. But we are where we are, and now we have an opportunity to make sure that Long Branch facility gets constructed, because it'll allow us to make sure we can get these access points into play many years before the hospital is completed and we retransform this campus. And so the Long Branch piece is extremely important, and I'm hoping that a resolution can come to the issues that are over there, and this thing can get under construction. Again, what's really fascinating to me is, and this is it's unfortunate, the real estate is very hard to find. Commercial real estate where you can develop something like this is horribly difficult to find. There is a major dearth of available space. And we're working also very closely with the Mary Center that's based in the District of Columbia, and some of you may have heard of that fine organization. We have a relationship, a partnership with them now. They have been working desperately to find space, and they've been working on it for a year to find space. And I think we're close now to an interim solution, but it's not ideal. They need several thousand square feet, and they're only going to get about half of what they need. But what we're looking at right now is that's an interim solution until the Long Branch facility is built, and then they can expand their operation into that facility as well. There's huge needs out there, folks, in this community, and we need to be proactive to figure out how do we preserve and expand, preserve what we have certainly, but more importantly, how do we expand that access to care? And it doesn't magically appear. We got to work proactively together to make it happen. And the Long Branch piece, after a lot of searching for property, the county actually pointed us to this parcel and said, can you build it here? And again, it's been a couple of years now, and unfortunately, it's not under construction yet. But hopefully that will come to a resolution. But hopefully that answers your question, Lois.
Yeah. Thank you. I think we have about at least 7 people who have signed up to speak. If anybody else is interested in speaking, you need to get your name on the list. I want to reiterate that, is that a hand that you want to speak over there? Yeah, what did you? No. Okay. I'm going to ask you to come to the mic and to state your name, and the first person on the list is Larissa, and also what organization you represent if you do.
Hello? Yes, that's better. Okay. Hi, Jerry. My name is Larissa Garan, and I am the president of the Birth Options Alliance. Recently, an organization previously known as the Tacoma Park Birthing Circle. We have expanded our mission and our geographic area to form the Birth Options Alliance, and as such, we're continuing to be an education and advocacy organization that supports pregnant women and families. We hold monthly meetings and sponsor an active listserv, and you can find out about us on our Birthing Circle website, tacomaparkbirthcircle.org, but we'll have a new website soon, the Birth Options Alliance, www.birthoptionsalliance.org. In response to recent closings of midwifery and healthcare services in the Tacoma Park area, Birth Options Alliance has become a rallying point for pregnant women, families, and healthcare professionals who are concerned about the loss of prenatal care and childbirth options in Tacoma Park and in the greater Washington area. So the Birth Options Alliance is very concerned about the changes at Washington Adventist Tacoma Park campus. With this loss to our community, it's added to the loss of the Tacoma Women's Health Center in April and the upcoming closing of the freestanding birth center in Bethesda at the end of May. Cumulatively, these changes will result in a loss of prenatal care and birth services to nearly 3,000 women a year in our community, not to mention the number of women who already are not being served sufficiently because of lack of access or insurance issues. And while you're relocating and you're not closing, the distance from Tacoma Park will also reduce its attractiveness as a birth site for many families in our area. And since it has been shown locally and globally that healthy mothers are a key to a healthy community, pregnancy is a critical entry point to the healthcare system. I'm sure I don't need to tell you that. Not just for the women, but for their entire families. When prenatal care is accessible and responsive to a pregnant woman's needs, she experiences health care as an important, integral, and non-threatening part of her family's well-being. And when she feels taken care of and is empowered with healthy behaviors, she's better able to empower her family with healthy behaviors. So we're talking about a public health impact here and not just women doing what they want to do. When she's encouraged to participate actively in her own health care, she's more likely to be a smarter and more active participant in the health care for children. So healthy mothers have healthy children and healthy families. And as a progressive community with a proactive and innovative, yeah.
I'm sorry to interrupt,
Yeah.
but we're doing.
I'm going to have a question. I definitely am. It's just that not a lot of people know about the Birth Options Alliance, and I wanted to set us up and not just say, hey, what are you going to do? So I appreciate that. I am being quick. I was told by Benita I had 3 minutes, so this is well under my 3-minute time limit, if I may say. Tacoma Park is well positioned to fill a gaping hole in healthcare access in D.C. and suburban Maryland, particularly with midwifery care and out-of-hospital birth options that are lacking in our community. Women who receive prenatal care and obstetrical care from midwives are less likely to have a cesarean section, and out-of-hospital and midwifery care are both endorsed by the American College of Nurse Midwives and the American Public Health Association. So what we're proposing as an organization that represents pregnant women and families is that the Tacoma Park campus be transformed, in part at least, into a nonprofit birth center with supporting services that has the potential to improve health outcomes for women across the socioeconomic status in our region. And since we are straddling Tacoma Park, Langley Park, Montgomery County, Prince George's County, the District of Columbia, we have a lot, we're perfectly placed to serve women across the socioeconomic spectrum. And we are just wondering what is, I mean, you've spoken of it briefly with your discussion of Mary Center and your coalition there. We've been working with Mary Center as well. So maybe we can all work together. But what is Washington Adventist Hospital doing in its current site to increase access for women to prenatal care? And what will you continue to do in your new location? And how can you help us to transform some part of your campus into a site that has midwifery care, out-of-hospital birth options, all of the access services that women would need in order to be healthy families? And then, you know, the concern of what the facility is going to, what Washington Adventist Hospital is going to look like when you leave. You said you're going to take care of the facility, but are you going to take care of it so that you guys can use it, or is it going to be habitable 5 years after Washington Adventist leaves the campus where it is and expands up to the Cherry Hill neighborhood?
Marissa,
that's a lot of questions, I know.
That's
sorry.
excellent. No, I love it.
I'm just going to interrupt for 1 second, because I know there's a couple other people from the Birth Options Alliance
Yeah,
who want to speak, and I'm going to ask, in the interest of a variety of different things, you can answer Marissa's questions, and then we're going to do some other questions, and then if some of the other questions of the folks from the Birth Options
We
Alliance.
carpooled and all got here together, so we've got our names on.
No, Marissa, great set of questions there, and I'll do my best to try to remember all of them, but you'll remind me, I'm sure.
I'm sure I will. Yeah.
That's great. I'll start kind of backwards here and make sure everybody knows that we plan on operating a high-end hospital like we do today until the day that the hospital closes. We're not going to modify it to meet some, future need or requirements out there. We're going to continue operating the hospital today, investing in it, making sure it's repaired and looks great. And we're very proud of the hospital. It has 100 years of service in the community, and we're going to continue that to the very day that, which will be an interesting day when we actually close the facility and open up the new hospital. But we're going to operate up to the day that it closes. You mentioned Mary Center. Certainly, we're very excited about that. We've been working on that relationship for about a year and a half. We have a relationship that's in place, and one of the things that Mary Center that they will be up in this area, and we have come very close to identifying a spot for them to start operating out of. And we've been working very closely with the county on that as well. You also may be familiar with the Montgomery County Maternity Partnership Program that we participate in. We started participating last July into that program, and we're probably going to do 600 to 700 deliveries this year. That's kind of the pace we're on right now out of that program. And the Maternity Partnership Program, just so everybody knows, and probably you already know this, but it's really for those women that fall through the cracks. They're really not eligible for Medicaid, and for a variety of reasons, and so they have no insurance. They can't get in any program. So the county has graciously developed something called the Montgomery County Maternity Partnership Program, and we have invested close to $1 million. It's a significant amount of money in bringing that program up. We actually have a clinic that operates in one of our buildings on the campus. We have it staffed with a full-time, high-risk perinatologist that is there taking care of women that are in a high-risk category. We have full-time OB physicians that are there seeing the patients. We have staff. We have facilities. We have 2 ultrasound machines. We have the sonographers. We have the full service piece in place. And we're very proud of that, and it's very important because this was a major concern of the county. We worked very close to the county to make sure we established that. And so, from our perspective, that's a very key access point.
Do you have midwives in that clinic or with any access privileges to Washington Adventist Hospital?
What's interesting, and I hope I don't bore anybody with this right here, but give me just kind of 2 seconds to describe. Hospitals are incredibly complex organisms. And one of the things, the physicians that practice at the hospital are actually very independent. of the hospital. There's something called the Medical Executive Committee that really, from the physician standpoint, they really are, the physicians basically manage themselves. We really theoretically can't tell the physicians what to do. Now, it's not quite that simple, but just so you know, the physicians are an independent body, and it's built that way across the country to keep separation of the medical staff from the hospital for a bunch of reasons. At our hospital and many other hospitals in around the country, and right or wrong, people can make their own determination on this, medical staff decide what types of physicians can practice in that hospital, what people can't. In Washington Adventist Hospital, midwives are not allowed to deliver babies in our hospital. It has to be a board-certified OBGYN. Again, I'm making no judgments on that. That's the way the medical staff...
I'll make judgments on that, though, respectfully. Sure. Mr. Sachs, that's not the best care by evidence-based practices for most women in the United States. We have higher C-section rates, higher infant mortality, more interventions. I know, I'm sorry.
We just need to keep it focused, and there's a lot of other people who want to speak.
It's just...
No, I completely...
I understand the independence of the medical...
And that doesn't mean we shouldn't be working towards looking at that in the future. I think that's something that ought to be looked at. You had specifically talked about, what about when the hospital leaves? Could there be some kind of a birthing center there? I think that should go on a list. I think we should be talking about that and figuring out, does that make sense? And I think, clearly that should go on a list for us to discuss and analyze. I'm sure I missed a few things there.
Oh, you probably did, but you said very nice things, so.
But I appreciate your dedication to your profession. I think it's very much to be commended, and I let's work together on it.
And I'm just going to, before we move on, I'll just intervene, and maybe it would be something that afterwards you can talk about having somebody from Larissa's organization visit the prenatal clinic and get to know what does go on there, and to pass some of these suggestions and some of the information on birth outcomes with the use of midwives to some of the staff there who may be unaware of this.
Good point.
I'd love to do that.
Yeah, look forward to it. Thank you for your questions.
We're going to jump to Patricia Powell.
Next, looks like Patricia Powell's out of the room.
Oh, Patricia, so we're going to go on to
she's...
Patricia, come over this way, Patricia.
Good evening. My name is Patricia Powell, and I'm the president of the Houston Arms Tennis Association. The question that I have is, would you be interested in polling a survey in the different communities?
Yes, thank you. I think that's a very good question. Actually, it's been asked before, I believe, by the group of creating some sort of an instrument to survey folks, and that's something we would absolutely support.
I'm really glad you brought that up, and the committee has been working very hard on having a survey out. We wanted to have it tonight, but for a variety of reasons we couldn't, including the health and well-being of many members on the committee who have been sick this week. And I'm really glad that you're from a tenant association, because one of the things that we know with surveys is that getting people to take the time to fill them out is very hard to do, and we have plans to send it out electronically through email, but we know that not everybody accesses email. We have plans to do it in English and Spanish, but we also know that some people, writing is not the best way that they communicate. And I'd like to get your contact information at the end so that when we have the copies of this survey, we can give you a bunch for the people in your tenant association, and maybe you and some of the other folks can help promote this, because the more we get back, the more information we have. And there's a great showing here tonight, but there's thousands of people in Tacoma Park whose voices aren't being heard tonight. And we know, speaking truthfully, that many of them are the low-income folks, or folks who have to work evenings or can't pay for a babysitter, or who maybe didn't hear about it because they didn't read the back of the city newsletter this week, or hear about it on email. And so we're really relying on tenant association and other community leaders to help us with this survey, so we can really get some other kinds of ideas of what the health needs are in the community. So we would like to enlist you in helping us with that survey.
Okay, and I also have a couple of suggestions the PTA through the schools. You can use them. You have the college campuses here. Even at the hospital, the emergency room, family members who are coming in, inpatient, outpatient services. That's a perfect opportunity to survey these people. Because my concern was that you would look at the people who are here and those who are not present and, represent the ones, who are here, a few people who are here. So there are a lot of people who are concerned about the issues at hand with the hospital leaving the area. And as she had stated, for whatever reason, they're not here, they're not present. But doing this survey, I think, would be absolutely critical in getting the information that will be necessary for you to make your final decisions.
Your suggestions are excellent. I love them. And also, just so you know, too, I'd be happy anytime to visit with your tenant association or other groups. I would love to do that and
Sounds
be
great.
available.
Jerry's being pretty modest about, or at least he's not mentioning one thing that I think that we all should thank him for. We talked to him about the survey instrument that we were creating, and we looked to Adventist for some financial assistance in covering the costs of sending the survey out and getting it analyzed and things like that. And they've already expressed a willingness to help subsidize the survey, and we just, should all thank them for that.
And I know it's unrestricted funds. It's like, getting money from the pharmaceutical companies. It's unrestricted. They don't have any say in what goes into the survey or what we say when we tally the information. They're just helping fund the survey.
In fact, they've not even seen the survey.
But I do think that your idea of having it in the ER is a good one. I know the return rate may be, if somebody's leaving there with a true emergency, a family member has just had a heart attack, the last thing you want to do is fill out a survey. But we also know that many people use the ER for primary care because they don't have access elsewhere. And we also know that many people spend a lot of time sitting in the ER waiting to be seen.
Exactly.
And so that's a great idea, and I would like to talk, as a committee, talk to Jerry about having copies of our survey in the ER and a place for people to return them that we could collect.
That's a good idea. Absolutely.
Thank you.
Marty Ittner? Oops, I'm sorry. We'll do Keith next. I skipped over Keith, but Keith is next.
Hi, my name is Marty Ittner, and I live in Tacoma Park on Flower Avenue. And this is a slightly tangential topic, but I feel that this is a great opportunity to bring it up. When we talk about the health of the community, I want to bring up the health of Sligo Creek, which is adjacent to the hospital. We have a landscape that has a very steep hill, as most of you know. At the top of the hill, there is a service road, which is impervious pavement. What happens is the stormwater collects on the pavement and rushes down the hill and brings with it silt, stormwater, rocks, and it's deposited on the creek path. And one of the biggest health issues to the creek is the stormwater runoff. And also the Chesapeake Bay, silt is a major problem to the health of Chesapeake Bay. And I feel that in talking about the health of the community, that we cannot leave Sligo Creek out of the equation. And I have toured the site with Jack Welsh, and we've identified a problem area there, and he's going to be doing some landscaping. But I feel like it is a Band-Aid solution, and I feel that this particular opportunity with you making lots of big changes is an opportunity to consider, and I know it's a big, big thing, but to take out that service road and put in some green space, some flat green space that the stormwater can seep in there as it should.
Marty, can you just clarify, where is this service road?
It's at the top of the hill behind the hospital.
Okay.
And it's directly adjacent to the park, adjacent to Sligo Creek Park. And then I'm just going to be really bold and say we would love to have that land donated to Sligo Creek Park.
Well, Marty, we have exchanged some really great emails over the last year or so about issues. Remember the vines in the tree?
I do. I do. And they're gone?
Yeah, and I think that was, you had great suggestions, and I think that's something we need to put on the list. I think there is an opportunity for us as we think about the reuse of the campus. How do we fix some of those things that have been in place for literally 100 years? In fact, if you would, a lot of the things that that go on today were allowed to happen, 100 years ago, 50 years ago, would never be allowed to happen today. And so I think it gives us an opportunity to look at how do we rehab that, and we make it more green, we make it more environmentally friendly. So we look forward to talking about it and through the next few years deciding how we should address it. I appreciate your. I've always appreciated Marty's just intense love of the Sligo Creek, and again, we've had a lot of conversations about it via email, and let's continue that process and talk more globally now how we can address some of those issues.
And Marty, can I, if I'm summing part of what you said up correctly for our purposes as the Health Services Impact Committee, is part of what you're requesting is whatever happens with that land, any kind of building or demolition that's being done, take into account the water and silt runoff as well as the overall health and well-being of the creek as well as the park itself?
I would go further than say take it into account. I would say it would be mandatory. Okay. It's a huge problem.
I just wanted to make sure I was capturing your.
Yeah,
okay.
that would be right. And Jerry, I wanted to just say thank you for the help you've given us.
Marty, I'd return that because you've been incredibly gracious through it, and it's a pleasure to work with you. Thank you.
Probably most people know that one of the reasons that Washington Adventist Hospital was founded in the site it was because the creek and the park was supposed to have all sorts of physical and spiritual healing properties, being away from the city and being a beautiful place of nature where it was good for R&R. So I think that's important to remember that.
Thank you.
And Marty, you probably know this as a historian, but at one point there was a dam on the creek, and actually people would have they'd have boats behind the hospital there, and they'd go out and they'd take, an afternoon row on the dammed up Sligo Creek, and that was, way back in the years ago, but there's actually pictures of that I've seen, so thank goodness that's not there anymore.
Thanks, Jerry.
You bet.
Keith, sorry I skipped you when I went to Marty.
That'll be an issue that Marty and I will discuss at home. My name is Keith Berner. I happen to live at the same address as Marty Ittner. I'm a resident of Tacoma Park. I have been an active member of the group Sensible Hospital Growth, the ad hoc citizens group that was engaged with negotiating with the hospital over its previously very large expansion plans. I do not speak for Sensible Hospital Growth because it is an ad hoc citizens group without elected or appointed leaders. I speak only for myself. And I want to clear up a couple of old issues. First of all, Sensible Hospital Growth, which I'll call Sensible Growth from this point on, never advocated for the hospital to leave this community in whole or in part. In fact, most of us have made use of a vibrant, thriving hospital and value its presence in our community. It came out after the hospital announced that it was leaving, that in fact, an office of the county had been encouraging the hospital to leave. I don't know the name of that office, but I know that it had to do with economic development. And I know that when the hospital announced that it was going to leave, County Council Member George Leventhal was quoted in the newspaper as blaming the hospital's departure on quote-unquote noisy neighbors and sarcastically wishing that he said he hoped that we wouldn't get sick, which of course in his sarcastic tone meant exactly the opposite. Councilmember Leventhal, if he didn't know then, he knows shortly thereafter that the county had been encouraging the hospital to leave. Councilmember Leventhal, neither he nor any of the other members of the local community, who I think defamed Sensible Growth, has ever apologized or said publicly that they knew that we weren't responsible for the hospital's leaving. The other thing that I need to bring up is I want to tell Jerry again, which I've told him, that I greatly appreciate the change of tone that he brought into the relationship between the hospital and the community. But at the same time, I have to say that my perception, and I think those of many other community members, we still wonder whether we have seen a fundamental change in what, for lack of a better term, I would call unilateralism. In fact, the members of Sensible Growth and of the community at large were taken completely by surprise when the hospital announced 2 years ago that it was going to leave. We found that especially surprising because we were involved in such close negotiations and, in fact, had reached an apparent agreement with the hospital over a compromise development plan. Now, I do not begrudge at all the hospital's looking at its long-term 50-year interest and deciding that it needs to go elsewhere. In fact, I think one of the benefits from Sensible Growth's involvement is the fact that the hospital did have to look at its long-term future, and I respect that. But I think that the hospital inadvertently contributed to the defaming of the citizens in this community who had been working very closely with the hospital by, first of all, never itself revealing that it had been in separate conversations with the county about the potential of leaving, and by not speaking up for us when George Leventhal and others defamed us. I also wonder at this point whether the hospital will work hard now to overcome a history of unilateralism. And the direct question I have for you, Jerry, is at this point, certainly I love the noises that I hear about your engaging the community in coming up with cooperative solutions for our health and future. But I want to challenge you to say the next time you are sitting in a board meeting or a staff meeting and contemplating plans for your future, will your alarm bells go off and say, wait, this is not a conversation we can have just among ourselves until we decide on a solution and present it. I want to ask you directly, will you make sure that you involve the community from the beginning of the consideration of possibilities?
Thanks, Keith, for your question there. And I did have the pleasure to work with Keith and many others actually on the Sensible Growth group, and I found them to be very very open-minded and certainly engaging, and certainly appreciate that, Keith. And I can understand there absolutely is a lot of way even many years ago, probably some old wounds out there. I think the hospital failed in its historically certainly failed in its ability to really communicate with the community. And I think, I think we learn from that. I think it's important to learn from the past and then focus on the future. How do we do it better? And I think that, we're always learning together how to best do that. I can tell you right now, I know that my intention personally and my leadership team in the hospital and Adventist Healthcare absolutely wants to do the best it can to engage the community to figure out what needs to happen to this campus. And I'm sure there'll be debate. I'm sure there'll be, arguments about how do we do these things. There'll probably be arguments amongst yourself about it. But I think at the end, hopefully, we will have gone through that process together, Keith. We will have been as transparent as humanly possible through the process. And, and if you feel like there's not transparency going on, let's talk about it. I think one of the things that I've learned as a, certainly even as a father, which sounds a little, it's like I'm talking about how my dad used to talk, 30 years ago. But, communication really tends to fix a lot of things. And I think the idea is to have a lot of dialogue going on and saying, like, Keith, hey, what do you mean by that? Or let's clarify that question, or whatever it may be. I mean, we can think of 1,000 different things we need to do. But I disagree with nothing that you're saying, and I think that we need to work really hard to make sure that we have that great dialogue. And I look forward to it. This is a multi-year process that we're embarking upon, which gives us a lot of time to get it right. We can get this thing right. So I look forward to it, Keith, and look forward to working with really everybody. So I appreciate the question.
And I appreciate your answer. I just want to wrap up with two things. One is, again, just to make sure that you're thinking as you're in private conversations with your staff and board, that you don't make final decisions unless you've double-checked with yourself that you've had conversations first. And then the last thing is just to say that as one of those people who never wanted to see the hospital depart at all, I hope very much that you will leave as much good, solid health care on that campus as possible, including a fully functional emergency room. Thanks very much, Jerry.
Thank you, Keith, and that's what we're here to do, to make those decisions together. Thank you.
I want to ask again, I know a couple other people have come in. If anybody wants to speak, to have their name on the list. I know some of the people from the committee want to speak. We have one more speaker on the list. But since we started this meeting, Joan Clement has come in, who is a member of the Health Services Impact Committee and also brings a unique perspective to the committee because she's also an employee of Washington Adventist Hospital. And Heather Mazur, who sat for many hours in this room a long time ago as a councilwoman in Tacoma Park, who now represents Tacoma Park at the state level. So welcome. Andrew, you're up.
Good evening. I'm Andrew Strongen. Jerry knows me well. I'm one of those he sat and negotiated with for quite some time. I'm not going to go back and rehash the old things. I'm going to start where Keith ended, which is, and then take it one step farther. I also hope that Washington Adventist Hospital leaves a fully functioning emergency room. And I also hope that whether it's on this campus or whether it's over at Arliss Street, that there is a clinic that's been long discussed, and I'm not sure promise is quite a fair word, but we got close to promises a number of times. There are loads and loads of people who don't have access to health care who need it, and if this community is about anything, it ought to be about providing for those kinds of people who need that kind of support. You've got 16 acres, that's plenty of room. But focusing on the future, your word, and I think that's the way to do it best. Well, it gets earlier every year. Maybe now it's September. It used to be October, November. The kids are asked for their Christmas list. And we can all sit here and tell you that we want an emergency room and a clinic and a birth center and more ball fields and, my goodness, a community center and a gym. And God knows we should protect Sligo Creek. And someone's got to pay for it. I just heard we're going to get maybe a 2-cent tax rebate. We'll see. So, call me a skeptic. Someone's got to pay for this. And I don't know who that's going to be, and I don't mind paying my fair share. But before we get too many in the community too wrapped up in writing our Christmas list, I'd like to hear something from the hospital as to how it imagines this 16 acres here is going to work. Who's going to fund it? How's it going to get paid for? What are we really talking about? If there needs to be part of that you already know needs to be a profit center to pay for the rest, we should know that so that we can think clearly and strategically about what we're willing to do to help the hospital help us, so that this is not going to be a conversation about what Washington Adventist Hospital can do for us, but rather what it can do with us. That's the way to move forward. That's what I would like to see.
It's an excellent clarification point, Andrew. And again, I appreciate all the interaction I've had with Andrew as well. It's helped me learn a lot, that's for sure. Clearly, economics play into every decision we all make, because it's got to sustain itself some way. And what we would look at right now, it's early on in the process. We need to really, as we're going through and we're thinking of ideas. But I think you're right, Andrew. You guys can even step back from that and say, okay, fundamentally, let's not even think about specific operational things we're going to be doing on the campus, because those will have different price tags. But how fundamentally are we going to pay for whatever's there? And I think it's a combination of things. I think clearly operationally there has to be enough funds generated off of either patient care services, through reimbursement, through Medicare, Medicaid, whatever programs, to offset major operating costs. That's extremely important that happens. I also would envision some grant funding as well. There's challenges of grant funding because you got to continuously write for the grant. But that's going to be important. There will be some philanthropic aspects of this as well. So there's probably going to be 3 major sources of revenue flow, again through either patient care revenue or other types of services that will be delivered there. That either there'll be some sort of either a copay or who knows. Obviously it's not going to just be healthcare services. There's going to be other things that you're thinking about too, And do those things, do some of those generate revenue? Some will, some will not. And again, the grant funding, applying for federal grants, state grants, whatever it is, because I think we're going to be able to come up with some pretty exciting things that we do there that hopefully the state and even the federal government will say, you know what, we want to help fund this because we think that this has a major impact on the community in a very positive way, and we want to be part of that. And then again, the third is philanthropic. You know, there's capital campaigns. We are a nonprofit organization, and we have limited funds. There's no question about it. In fact, we're also a very important link in the safety net for people that need access. Andrew's absolutely right. There are a lot of people that need access. In fact, something that we've talked about is the vision for expanded access that we announced in 2005, and part of that was the relocation of the hospital, because we want to make sure the hospital is strong and vibrant for the future. We also want to make sure that we have adequate access to health care right here, and we need to define what that is. What is it that we need? What is it that you want? And in fact, in 2006, Washington Adventist Hospital provided $22 million of uncompensated care, nearly $22 million, just shy of $22 million. That's a lot of money. Very proud of that. We had the highest percentage of uncompensated care that we delivered out of any other hospital in Montgomery County. And you know what? That's okay. We're okay with that. That's part of our responsibility, and we are here to serve people. And we've got to work together to figure out what are those access points we need to be creating and how do we fund that. We don't have all the answers for this. We need to have you help us through that process. Because Andrew is right. The money is always, always at the table because things don't magically happen. Someone's got to pay for it. Either the government pays for it, private philanthropy, pays for it, or through the services generated, the revenue flowing off of that pays for it. Excellent question, and that's something that needs to be discussed continuously. Because I think it's good we talk about it now, Andrew, because we don't want to put something on the table that says, oh, this is a great idea, but there's no way that's going to get funded. Who's going to pay for it? And so I appreciate that, Andrew. Excellent question.
Got a couple more people on the list. Robert Lanza.
Hi, I'm Robert Lanza. I live on Cedar Avenue, and I've been a customer of Adventist Hospital since I moved to Tacoma Park in 1995. I'd like to first say that I think it's a tragedy that another community is going to get a full-service, state-of-the-art hospital, while Tacoma Park residents are here talking about what we can get for our site. I think that to the extent that you can support it, the entire site should be used for health care. We shouldn't see houses, we shouldn't see stores, we shouldn't see other things that are not health care related, because we need the maximum amount of health care that we can get here in this community. I happen to know somebody who was alive today because he had a heart attack and he was sent to Adventist, who saved his life. If he had gone to Forest Glen, if he had gone to White Oak, he wouldn't be around. So I agree with other people here that we need a full-service emergency room at the hospital site. We also need, in my view, many of the diagnostic services that you currently provide, such as radiography, mammography, blood tests, those sorts of things. The other thing I'd like to say is that I've been going to the hospital offices, medical offices on the hospital site since 1995. Those offices are in desperate need of renovation, and in terms of providing a opportunity for doctors to expand their services at the site, those offices need to be expanded, they need to be renovated. And I'd like to see, with respect to previous comments as to who's going to pay for this, we'll all pay for it because hopefully we'll all continue to be customers there. So whatever you can do to put as much health care on that site as possible, that's what I think should be done. Thank you.
Thank you for those comments, and we look forward to working closely with you to determine to what extent the health care services should be delivered there. And, you know, again, I appreciate the opportunity to be able to start this dialogue, because really we are kind of at the beginning of a journey right now together, and how this is going to all come together. But thank you for your questions. They're great questions.
Jerry, we do have 2 more speakers, but I think this is a good time to ask a point of clarification and something that our committee has discussed a great deal, and we haven't really known the answer to. And it's not to say that there will be a freestanding urgent care center left there. Certainly, it sounds like most people here want some kind of emergency services. But can you either describe what is offered at your emergency site in Shady Grove, or what actually, in your mind or in Adventist Healthcare's mind, a urgent care center or a freestanding ER has with respect to things like Robert pointed out, somebody went with a heart attack and probably meant a trip to the cardiac catheterization lab and ongoing nursing care for a couple of days. Is that something that could be taken care of in an urgent care center? Is that the kind of patient that would be shipped out to a full hospital? What does urgent care look like for Washington Adventist, or what does it look like in Shady Grove?
Well, there's clearly very specific definitions of these things, Lois, as you bring it up. Now, Lois is referring to the Germantown Emergency Center that was recently opened by Shady Grove. It's kind of an extension. I can't recall. I think it's probably 6 or 7 miles away. Rob, I don't know if you know the exact distance of that facility. Rob at Jepson's indicates about 7 miles away from the Shady Grove. Not 9 miles, okay, 9 miles away. And there was a massive need in that area. I could probably spend a good 15 minutes just talking about that and that project. What I will tell you is that the Germantown Emergency Center actually required special legislation to get that done. It's a unique in Maryland. It's a freestanding, full-service emergency center where ambulances go to. I don't know if they still do tours of that location or not, but it's really it's a very modern 21st century emergency department where they can handle anything. Now, if someone goes there and they do need hospitalization, they have a transport process in place. In fact, the county parks an ambulance there all the time, is available to transport. It's not unlike other access points. I mean, that happens. Fire stations and ambulance locations are positioned strategically. They're waiting and ready. Well, there's one waiting and ready there. If a patient needs something, needs to be transported, they can transport them to Shady Grove. And they're seeing right now, I don't know the exact number. I think that they're on pace to do about 24,000, 25,000 visits annually, and it continues to grow. But that's kind of the extreme. That's short of a hospital. I mean, everything that, all the equipment, literally every piece of equipment that we have in our ED, they have in that freestanding ED. There's nothing there that they can't do. CTs, MRIs, all the high-end cardiac. They cannot do a cath there because that's by regulation you cannot. It has to be in a hospital environment. But what they can do is with the and I'm getting out of my area of expertise. I can't talk as a doctor can talk. Actually, Lois, you'd be in better shape to talk about the specifics. But it's amazing what they can do with the drugs and therapy to stabilize a patient, to get them to the intervention that they need, and all that's been worked out through protocol, and it works very well. It's it's very effective, and I'm sure over time, as we go through this process and as we talk about the needs, that's something that we can look at in more detail together and determine what does that mean. What does urgent care mean? Urgent care is another kind of a level of care. It's lower than an ED. You don't typically have some of the capabilities in urgent care environment. And then there can even be a step down from that, from a clinic, just a kind of a walk-in clinic where not unlike your physician's office you might go to, it might be extended hours. Instead of closing at 5, it closes at 10 at night. And again, from our perspective, we need to talk together. What is it that is required and needed? And that's the reason why we're here, is to work through that together. We're going to be working with you very closely to say, okay, what does that mean? as an example, the Germantown ED will require for you folks to support that from a legislative standpoint as well. So there's going to be, and I think that's great because it allows us to kind of come together and say, and go to the state and say, we want this here, or whatever that may be, whatever that this is, we're going to have to work together on it. And I feel very comfortable if we do it that way, we're going to be successful. No matter what we decide to put here, if we go collectively to the powers that be to grant authority or grant whatever it may be, a license or whatever it may be, if we do it together, grassroots, us together, we'll get it done. We'll get it done. But we're going to absolutely have to rely on each other to make it happen. I don't know if that helps.
No, it does help a lot. I think it does quite a bit.
And at some point, you may want to tour some of it. You may want to tour an urgent care facility, and probably all of us have been to one at one point, or tour, the Germantown ED or whatever else, and get a sense of what that means.
Great, thank you. Mari Rothman.
Hi, sorry, I came a little bit late because I was coming from a meeting with Congressman Van Hollen, as a matter of fact, on a similar issue. I am a certified nurse midwife, and I work part-time for the American College of Nurse Midwives, and then I also am a volunteer member of the Maryland chapter of the American College of Nurse Midwives, currently the co-chair of their legislative committee, which was what I was doing on the Hill today. But I want to take the birth center off of the Christmas list, because it's not a gift that we need. It's actually a way to pay for all the other gifts by saving the county a huge amount of money. So it's not another pocket that needs money put into it. It's actually a way of saving a tremendous amount of tax money. And I want to bring our consciousness to the Family Health and Birth Center, previously known as the DC Birth Center, which is in a ward of DC that had the worst infant mortality rate in the city that has the worst infant mortality rate in the United States. And in a 5-year period, they cut the infant mortality rate in half, increased the breastfeeding rate to 90% for all the moms that breastfeed there, and did all this with like a 10% C-section rate. So if you want to translate that into dollars for Montgomery County, you can say, for instance, let's say 100, and the reason wait, let me backtrack a little bit. I'm also here just as an individual nurse midwife, representing myself and my would-be partner, Erin Fulham, who was at the births of a number of people in this room, except she was there in her capacity as a midwife from Birth Care and Women's Health in Alexandria, because we don't have anybody here to do home births. We have been wanting to start a home birth practice aimed primarily at uninsured Latina immigrants for the last 5 years, and because of the laws of the state of Maryland, you have to have a written practice agreement signed by a physician in order to get your license in this state. We could have started the practice years ago if we lived in Virginia or D.C., but we have this sort of obsolete law in Maryland. And to give you an idea of how ridiculous it is, you can have someone sign your practice agreement who's at a hospital in Baltimore, only you're practicing in Tacoma Park. So if you call 911 from a birth, you're not going to take your client to Baltimore. You're going to take the client to the nearest hospital where they will never have seen your practice agreement. So we need to get rid of that. But so let's say 100 Latina immigrants have babies at Holy Cross Hospital, which has been managing a huge number of those births and is overwhelmed, and there was a big article in the Post about that. They have something approaching a 40% C-section rate there. Okay, so let's say you have 100 women, 40 of them have C-sections, so that costs about $15,000 per woman, uninsured, paid for by the county. Let's say that we took care of those women instead. It would cost about $3,000 for each of them, and 30 of those 40 would not have C-sections. So we would have saved all that money for all those unnecessary surgeries. And not only that, instead of going through a machine-like experience, they would have had personalized, safe, culturally sensitive care with care providers that would enhance their self-confidence as moms and improve their quality of life in many different ways. So what I want to suggest to you as a plan of action is that I think it's really, really important as you go through this process to form some kind of, not just have hearings like this, but have an ongoing community task force that's made up of representatives from the community that represents an actual representation of the demographics of the community, including midwives, doctors, nurses, nurse practitioners, people that work with the segments of the population that need health care that costs the county something, and make sure that the Latino voice is heard, because I've spent 2 summers in El Salvador, and what I've noticed about that culture is that, you know, if you lay out a buffet and you say to everyone, help yourselves, that's a really American thing, a really North American thing, that you just go and take. And what you need to do with somebody from their culture is say, here, you may have this, and put it in their hands. So they're never going to come to a hearing like this and say, we want, we need. Okay? So it's really important that we include their voices, because unlike a lot of parts of this country, in Tacoma Park, we feel like our Latino brothers and sisters are just as worthy of having good health care as everybody else, and they need to be represented. And also, when you're pulling together panels of healthcare providers, please don't just have it be a bunch of white male doctors. Thank you.
Thank you very much for your comments. I appreciate that.
I'll just comment a minute, Mari, and for everybody, just to let you know that I did personally extend an invitation to Elisa Jaramillo, who is the Director of Saludes Vida at Casa of Maryland, as well as Christy Swanson, who is the Director of Social Services at Casa Maryland, and Gustavo Torres, who's the Executive Director. And I personally know all of them and work closely with them, and asked them if one of them could be here tonight, and left it in their hands to figure out which one. And I do think that bringing the staff of Casa Maryland is very different than bringing the users of Casa Maryland. So it's not to say that that's sufficient, but we certainly acknowledge that need, and the survey that we mentioned will be produced in Spanish, and I do provide health care as a nurse practitioner at Casa of Maryland to the day laborers and their families. So we have talked about getting the survey out, acknowledging that, again, in that culture, filling out a survey where you check boxes is not necessarily the way that we could get information, and so looking into their health promoters and other ways of hearing from them, many of whom live in PG County, which adds another layer of lack of access. So that's something that the Health Services Impact Committee has looked closely at.
And I think it's great that they were invited tonight and everything, but it was really hard for me to get here tonight, and it was just a one-shot thing, and I couldn't come to the last one. So that's why I'm suggesting it's ongoing involvement. Like, if you know, when you're busy and you have a job and children and stuff, if you know that, you know, every other Tuesday you're going to do this, it makes it easier to commit to being present to the process. Thanks.
You know, again, I would like to extend an invitation. I'll come and you know, visit with you folks too. If you think that would be helpful, I'd be happy to do that. Because I have actually been following what's been going on that front, and I think it's unfortunate what's been happening with the closure of those facilities, and so I'd like to talk to you more about it.
That would be great.
Sure. Okay.
Thanks.
Look forward to it.
This may be a little bit off the record of my role as the co-chair of the Health Services Impact Committee, but I do think that the Washington Adventist Hospital making a pro-midwifery stance would add a lot of credibility in this community where people are feeling the loss of midwifery care. And even if it's just saying, you know, we support midwives in Maryland or in Tacoma Park, I think that would go very far. And then, of course, actions to follow.
Yeah, that would be great. I would love to talk to you further about that.
We have one more speaker signed up, and then Heather, do you want to be on the list? We have Emily, whose name I can't pronounce, and then Heather, and then this gentleman.
That must be me. My name is Emily Kirschlin. I live on Garland Avenue in Tacoma Park, and I have also been part of the group that Keith mentioned, Sensible Hospital Growth, and a few years ago was quite concerned when, under an earlier president, the Adventist Hospital announced that they were going to they wanted to build another physician's office building on campus. I was concerned about traffic, et cetera, like many of my neighbors, not all my neighbors, but many of my neighbors. But one thing I do not want to see, and other people have mentioned this, is I'm very concerned about the possibility that we will not have emergency care nearby. And Jerry, you keep talking about being still in our community, but this new site is 6 miles away, and as most of us know, and with a dense population and heavy traffic in this area, it can take 20 minutes to half an hour to get to Cherry Hill Road and Plum Orchard, whatever, to that target, because I've been there. So it's not in our immediate community. And so I very much want to see an emergency room stay in this area, especially with the threatened closings of other hospitals and the closings of other hospitals. And whatever we can do to have something like, it sounds as if what exists in Germantown would probably be a great thing to have here too.
Yeah, thank you very much, and we look forward to talking to you more about that.
Heather?
Hello, Heather Mazier, 7200 Maple Avenue. Jerry, I want to thank you for your ongoing dialogue with the community, and I think those of us that worked with your predecessor have very much appreciated the welcome new directions that you've brought in community dialogue and your interest in working with us. And not for a lack of trust in this process, but for due diligence as community advocates, I'd like to know whether or not you can share with us timelines. My ability as a member of the Health and Government Operations Committee at the state level that looks into things like approval of the Certificate of Need process, you know, no-brainer usually when it's a new facility in a new area where there's need, but there's certainly more issues at play when one community is losing services and another community is receiving it. I don't feel comfortable signing off and saying, yeah, that's a good thing, if I don't know for sure what our community is going to get. And so if you could help us understand timelines rather than just a promise that we'll work together, what sorts of things can we get concrete before I'm asked to sign off on some of these things at the state level?
Thank you, Heather. That's again an excellent question. And one of the things that we have I've actually talked to the committee about is this, you know, obviously the need for dialogue, and it's got to go beyond that. We've got to start getting specific. One of the things that I've talked to Andrew about is working to proactively be in the community interviewing folks, and we're going to be working on that process. I talked to you about a couple of gentlemen that, one of them's here this evening with us, Vince Day. If you could raise your hand, Vince. Vince and he works with a gentleman named Scott Keller, and they've got a lot of experience in this, working with nonprofits. In fact, they're doing some projects in D.C. right now with the D.C. government related to healthcare access issues in that community. They work all over the country. They did an incredible project that I've had the opportunity to see in Detroit. There was a hospital, and again, I won't get in too deep into the facts, Vince, because I don't want to get them wrong, but there was a hospital in Detroit as part of a Catholic health system there that was built, I believe, in the early 80s, or opened up in 1980, and then subsequently could not sustain itself. And so you have a hospital that had 400,000 or 500,000 square feet that was in essence going to go out of business. And Vince and Scott and that organization worked very diligently with the community to figure out how to reuse this hospital. And what they did there, their solution was, and there's probably some corollaries here on this, is that they took that facility and they turned in a big chunk of it into a nonprofit village. And there's something like 92 nonprofits, some are just one person, operating in that old hospital. Actually, it wasn't that old. It was built in 1980. Over 90 nonprofits, and you would walk into this hospital, and a previous hospital room was someone's office. And it was, you know, Acme nonprofit, and they were doing something, and they were an incubator or whatever, and there were some larger ones, some smaller ones. Stunningly fantastic what they did there. Is that the right thing for here? We don't know. We need to be working together to determine if that's one of the things we want to talk about. There's also clinic operations there. There's some healthcare services being delivered at that location as well. There are models that I think that we can tap into and look at around the country. We may say, you know what, we don't like any of them. We like that part of that one. We like that one over there and that one over there. And that's what's exciting about this, because we really do have an opportunity to determine how that's going to work. In terms of a timeline, Heather, what we want to be doing this summer and into the fall is really trying to get as much input as possible, getting people to put ideas on the table. And I think in probably pretty short order, we would say, well, here's kind of the laundry list. There'll be duplication, you know, and we'll say, well, here are the 15 things that appear that people want. And then we need to start working together to vet those out. What does it mean? How do we fund it? What's it going to take for any construction that might be required to remodel facilities, and work through that process? And I think it's, you know, your point is extremely important, Heather, in that people are going to be nervous saying, well, we're going to be making decisions, but what commitments do we have that this is what's going to happen here? And I think that's really the essence of your question. And I don't know if I can answer it specifically because the timeline, I'm not sure exactly how the timeline works. We need to figure it out together how that works. But we need to make sure you get information in your hands at the local level, the county level, and the state level to make really good decisions. And hopefully that's beginning to answer the question.
Yeah. Might I suggest perhaps a willingness to do various kinds of timelines? You know, we could have one set of timelines that could at least be absolute sign-off on concepts. If we all end up agreeing that what we're looking for are emergency and primary care services, saying yes to that with the details of exactly how much services, under what kind of operating hours, under what kind of, you know, exact, you know, primary, tertiary, acute care scenarios. We can figure out the scenarios later, but would you possibly be willing, if there seems to be consensus building at some point during the initial outreach efforts, that there are a range of issues that keep coming up over and over again, would you be willing to commit to concepts so that we know what we can hold you accountable for, and work with you to flesh out over the long run? But we don't want to lose our leverage in this discussion by just you know, having a friendly community agreement that somehow, some way, we're going to work some of these things out later.
It's got to be that, Heather. We have got to work together to have a strategic plan, you know, to put it in those kind of terms. We've got to have a strategic plan that lays out timelines, because the only way you're not going to be able to make decisions at the state level until you understand what's going to happen here. Absolutely. I mean, I don't see any other way of that working, and I think we need to figure out over the next, you know, few months here, and this shouldn't, hopefully this wouldn't drag on for months and months and months. I mean, it's going to take time, and obviously we're going to be here for a number of years, but I think you're right. We need to be able to come within some reasonable period of time. You need to help us figure out what that is. And part of it, too, will be we're going to have to be at the point where we can kind of close the window on the ideas. And I know that's hard to do, but at some point we've got to say, okay, folks, we have vetted this for the last 5 months, 6 months, 9 months, 3, whatever it is. We got to close the door on the ideas now, and we got to go to work on developing the plan, come back with a timeline, and say this is what we're committing to do. And does that mean we actually sign in a contract? We got to decide what does that mean, because we want to make sure that everybody is comfortable and says yes, we support this, we know what's going to happen, that's our plan. And I think Heather, it's great. That's exactly what we need to be doing, and we're going to need your help to kind of figure out what your time frames are as well, what you want to see happen. So, but thank you for that. We'll make sure we follow that path.
Thank you. Billy?
Thank you very much. My name is Billy Sambat. I've lived in Tacoma Park neighborhood almost over 27 years. After I have lived around here, the only place I know was used to go to see my doctor is Adventist Hospital. And luckily, because of my relationship, I have developed a close relationship with the pharmacists and doctors. And today, when I hear, it's not only today, I've heard about 4 months ago that Adventist Hospital is leaving. I had a mixed feeling. In a way, the blessing is I also live, my wife works at Adventist Hospital. I live in those 2 buildings they are trying to sell, and unfortunately, I'm going to be a homeowner. That is a blessing. And not only that, I'm the president of the Hilltop Tenant Association. I've urged them to come around here. Not only that, there are a lot of people in this neighborhood. She mentioned Victoria. There is frankly a lot of senior citizens who could not make it on either by all means of transportation to hit Route 29. As you know, the traffic is treacherous. I know I have friends who live around that area. I have been here when the first time the Washington Adventist Hospital requested for an expansion, and the debate was tense. I remember a kid, and there was a very emotional fighting. I really want to be in between, but it looks like it's a no-win situation. Everybody was trying to assert. And then the cry was overall was, how can we accommodate best, this traffic congestion. As you know, there are 2 streets, Maple Avenue, Carroll Avenue, Flower Avenue, coming to the hospital, and also fulfills the interest of the Washington Adventist Hospital to find a good physician office. I know physician office is critical for the hospital at this point because they get referral from physicians to be admitted. We understand that. And there was a lot of room for accommodation. What is the best way to do it? There was a possibility to come out. And after that, and I've heard the city council was here, Mayor Kathy Porter was here. 2 people came in here emotionally. I knew that Washington Adventist Hospital has donated $750,000 for this expansion for our municipal youth. That's a big thing. And also we appreciate that you provided, health care is a right. Unfortunately, in one of the most developed nations, this is the only country I know of, who is fully developed. There are 40 million people uninsured. I know the hospital is overburdened. And we, as, service users, also cannot accommodate the insurance. And also some of us, if we have insurance, it's becoming so expensive with the income we have to, facilitate that. The burden would be in the hospital. We are trying to work out, how can we have a community, Tacoma Park Community Action Group here. We had a survey now. What is the health care? How much you have? How much money you use? This kind of question we're trying to find out. I've also attended about 2 weeks ago, Silver Spring Impact, about the health care, the problem, the burden. And as you all know, the reporter on Calvert in the Wisconsin Avenue was shot. Nobody realized they were running him around the hospital, and he died because of not getting attention, We have a huge problem. You pointed out one thing today, the major reason why you're moving to those areas is to get a 21st health facility. I have been around, fortunately, around the world. I have been in Japan. I have been in London. I have been here. I went undergraduate at Howard University Hospital. It used to be Freedman's Hospital. The area that is using the hospital for Freedman's was much less than you are using for this. And I was also a George Washington University graduate. The George Washington Hospital they built now, the facilities they use, they modernized it, and the facility is not even a quarter of a block. It's how to use efficiently and effectively. the hospitals. It's the state of art, the people, that makes the hospital grow. I know you've been expanding in a limited scope parking on this wing, and also there is a big space, and the hospital has been built a long time ago. It's never been put on the roof. When you go to Holy Cross Hospital, they have added roof on the top. They have parking. They always remodify, okay? That has never been done. I think I see the entire people, their request. We don't want to die in an ambulance. We want services. So I see some feeling from you. You want to hear the community. The community is not here, As you know, it's a very talking community. We got to reach out, and I want you to reconsider your moving, and try to use this vital space effectively and efficiently so that we all be benefiting, and try to create a transportation system, the 21st transportation system that's not going to create a gridlock. If we work together, we can win. That's what, my suggestion is. And that area that you are acquiring, we can use it as a golf field because FDA is going to move on New Hampshire Avenue, and you're not going to lose for the area that you're trying to, acquire. So I think I want you to use, I don't know how much, serious consideration you have made in, retaining this place. If you leave, please don't leave us without any basic, needs. Thank you very much.
Well, thank you for your comments. Again, I appreciate them and look forward to working with you very closely as we go through the process. Thank you.
We have two more, and then I'd like to ask the Health Services Impact Committee if there's anybody who has any questions as well. Diane Berkeley.
Good evening, everyone. I'm sorry y'all came in late. I had a meeting upstairs. My name is Diane Berkeley, and I'm with the Tacoma Park Community Action Group. And I missed a lot that was said, but from what I gather, we're talking about the Washington Adventist Hospital. Well, I want to invite you all to the Franklin Apartments. I live 7620 Maple Avenue. We have a lot of disabled and senior citizens. We have a lot of foreigners there that we need your help. If it's possible, I would like for you all to come to the Franklin. We have potluck every fourth month, every fourth Thursday of the month. Fourth. It was the third, but we changed it to the fourth.
I'm sorry, the fourth, which day is it?
Every Thursday, the fourth Thursday of every month.
Okay.
And talk to the senior citizens and the disabled people, because I myself, like the hospital where it is, it's just right up the street. We have a lot of senior citizens that if you move, we would all be in bad shape. I'm from out of town, and I don't know where 29 is. So I would be trying to go to Doctor's Hospital or Holy Cross when, they can just go right up the street. And a lot of them depend on Metro access, which is always late. But if you call Metro from where we are and they 10 minutes late, then you can still go to the hospital and be seen. A lot of places, if you're 15 minutes late, you have to make another appointment. So I'm asking you all to come visit us, talk to the people at Franklin on the fourth Thursday of every month. Thank you.
If there's food, I'll be there.
Ms. Berkeley, one of the things that we talked about maybe before you came in is that this committee is trying to go out to different areas in the community, and we have gone to Victory Towers to talk to some of the elderly and disabled there. And we would very much like to take you up as a committee on coming there and hearing from the people who live where you live about what they want in healthcare in this community. So if we could talk about that after, we'd be happy to come on the fourth Thursday of the month, and we'd even bring a dish.
All right, thank you. Bless you all.
I'm not sure if you want me to bring a dish, but I'm happy to come. Okay. You'll feed me. Thank you very much. Look forward to it.
Good. Our last speaker is Catherine Tunis, or our last questioner, I should say.
Hi, I'm Catherine Tunis. I've lived here about 15 and a half years, and my understanding is that from tonight what you wanted to do is to hear from the community what they think their health care needs are and what's most critical for Washington Adventist Hospital. I think obviously we want to keep the whole hospital here in Tacoma Park. A lot of people do. We've found it a tremendous asset to the community. One of the top things clearly, which I've heard before since I've been in the room, is emergency services. Emergency services for cuts, scrapes, broken bones, bleeding, gunshot wounds. Not that I have this, but birthing for health care, heart attacks, strokes, and the related diagnostic equipment to figure out what's going on with somebody when they come in with something they don't know what's going on, and it may be something serious. I've had CAT scans in the middle of the night. Not pleasant. I don't want to do it again, but I'm really glad that it was right there. I'm also really glad that it's close to home. I just last week went in an ambulance with my neighbor to the emergency room. I didn't worry about it for a minute because I knew I could walk right home. I didn't have to worry about how I was going to get home. If somebody's going to have a heart attack at 4, 5, 6 o'clock at night, they're not going to be able to make it up New Hampshire Avenue. They're going to be a dead duck. So that's, we do want to keep the services here, the whole services, but at least I think key things are the emergency services, and perhaps we can talk later. I'm not sure whether you've talked about possible other opportunities for if and when the hospital does move, what other things might be done, and I'm not sure if the committee is going to have like other brainstorming sessions for those types of activities, but I wasn't going to go into any ideas now. The other thing that I would like to mention, I realize it's slightly off topic, is that often when the hospital was in here talking to the community before, they talked about their reasons for either rebuilding or moving was because of cost concerns. One of the things that I noticed is that all trash goes into the red bag. That is costing you 7 to 8 times what ordinary solid waste costs you to dispose of. I would suspect that there are a lot of other cost-setting measures that could be done if a competent auditor went through the hospital, and I would urge you to do so. Thanks.
Well, thank you, and I do spend a lot of time dealing with cost issues. I appreciate that.
I forgot to say something really important. At least it's really important to me. I live 3 blocks from the hospital on Garland Avenue, and I have a husband who is anaphylactically allergic to bees and refuses to carry an EpiPen. So we've been really glad that you've been there a couple times, because he insists on mowing the lawn anyway. And I have 4 children, one of whom is a wild and crazy 13-year-old who has had more body parts x-rayed in your ER than probably everyone in this room put together. But I just wanted to let you know that I'm also a neighbor, because I spoke as a professional before, but I live here too.
Great.
Can I buy your husband an EpiPen? He needs to carry that.
I'd like to ask if there's any members of the Health Services Impact Committee who have any questions or comments at this point. Send it home with Mari.
Hi, I'm Fred Hofflinger, and I'm also a neighbor. I live a couple hundred yards from the hospital. And, I do appreciate a good night's sleep, and so when the helicopters come over, I realize that there's a reason they're coming over, and I just roll over and go back to sleep. So maybe I won't miss the helicopters, but all in all, I think I'd rather keep them. Jerry, about the $22 million of uncompensated care, this is a subject I know a bit about, and I know there's various ways of computing that number. Who can give me the components and how it's pieced together?
It's actually a standard computation the state requires you to make. So every hospital in the state has the same computation as far as how uncompensated care is calculated, and we'd be happy to give you that calculation.
Yeah, okay.
But it is a standard calculation that everybody has to do. And
Thank you. Yeah, I'd
Yeah.
appreciate getting into the guts of it. Thanks.
Sure. How do you want us to send that to you? Just okay.
Yeah, Benita can do it. Thanks.
Okay. We'll make sure you get that calculation. Yeah.
Pat, Seth, Trevor, Joan? And there's one more member of the committee, Dr. Joanne Wu, who is a naturopath and acupuncturist who couldn't be here tonight.
Hi, maybe this was talked about before I came, but I was wondering, there's been some early on discussion about maybe a dual campus approach, and just wondering if that's feasible to actually continue to operate the hospital, or at least some aspects of it.
The short answer is no. There's not, and a lot of that's driven by regulation. And again, the state is very prescriptive about, there's a health plan out there that says only so many beds are allowed in the state, and it's all heavily regulated. And so, the ability to split a campus apart like that is pretty much impossible to do. The other, probably more important factor, even if that could be changed, is the operating cost of doing that. It's very expensive to run 2 full-service hospitals. It just, because the assumption would be is that you're not necessarily expanding necessarily the number of patients you're serving. Hopefully you are, but there's just a lot of cost issues related to that that we would be very concerned about, because we got to make sure it's viable long term. We've thought about that. I think it's an excellent question. That certainly was discussed and looked at and tried to figure out, could we do it? And in fact, at one point in time, we were really seriously trying to figure out how to make that happen, but we realized that from a regulatory standpoint, it was not feasible, and then from a cost standpoint, it was also very problematic.
Even if the Prince George's Hospital goes under, there's still the cost problem, even though you'd have beds then, but maybe it's still not affordable.
That's a critical issue, Prince George's Hospital Center, and I think it's indicative of some of the issues we have, not just around here or the state, but really across the country. And kind of the history of Prince George's Hospital Center and why they're in the condition that they're in is very unfortunate. If that hospital closes, and of course there was a reprieve, I guess, for 15 months on that facility, but obviously that'll come back again to become an issue next year. And from our perspective, we were already working on how do we manage the patients. We want to provide as much care as possible to as many people as possible, and it will be a challenge. But we're gonna try to figure out. It gives us some breathing room, hopefully, to figure out how do we do that. And I think the state will obviously have some input in that, what happens. But if that hospital should close in the future, it will create a lot of issues. But again, we're going to do whatever we can to take care of the patients.
Seth Grimes. I hate it when people say to me things like, Seth, you're a great guy. Occasionally people will even say that, and I'm going to say it to you, though. It sounds condescending, and you're a marked change from the previous hospital administration. Yet I find that I'm much more disturbed at the end of this meeting than I would anticipate being more disturbed about the situation than I was coming into it. When Andrew Strungen asked you who's going to pay, you came up with answers like grants, philanthropy, stuff like that. We know that the Columbia Union College is struggling to raise money in a similar demographic basis and so on. Yeah, they're a different institution and so on. Philanthropy is easy to talk about. It's hard to do. When Heather Mizzier asked you about timelines. You came up with summer, fall, we'll start a discussion going. When people have brought forward to you specific things they want to see here, universally, people want to see emergency care here, if not the whole hospital facility stay. People want to see maternity, including, I'll call it alternative because that's what it is to you, but midwife-centered things. Your answer to all these is, let's have a discussion. I don't see what there is to discuss. People have been very clear about the main points, the emergency service, the maternity, and so on. They don't need to know about timelines of summer, fall. It's very vague. I'm disturbed because of the vagueness of the responses. They're very nice responses, but they're very vague. I could just reiterate that the questions that other people have brought up are ones that I don't see as having been answered.
Well, Seth, I appreciate your discussion on that. And Mary, did you have your hand up on something?
You go ahead, and then we'll put Kathy up.
Oh, okay. I appreciate your comments on it, Seth. And, you know, we, again, are going to do the best we can to try to figure out how to navigate through this. Well, we want to do it right, and we want to make sure that people have input on it. And, you know, I think your question is a good one. I think it's a fair one. And I guess, again, when Heather and I were discussing the timelines, when she asked that question, I think that, you know, what we want to do is get to the point in the fall where we can have a very definitive kind of portfolio of action items. I think it'd be naive of me to say it's going to be the specific date, because I think we got a lot of work to do together to figure out how to get there. And I think your point about philanthropy is a good one. I think there's a lot of hard things we got to figure out. How is it paid for? I think certainly some of it will be subsidized by the hospital to the extent that we can do it. I mean, there's only so much revenue flowing, and we want to be able to continue providing $22 million a year worth of free care to people, in essence, uncompensated care. But that just doesn't magically appear. We got to figure out how to do it. And as we make these commitments about providing service, access for people to get care, no matter who they are, what their situation is, we've always got to talk about how do we pay for it. But I'm looking forward to that discussion. There's not an easy answer to it. I think we're going to come to those answers as we go through this process, and that's the reason why the committee has been formed, is to work to figure out what the answers are going to be. Because I think it would be wrong for me to come up here and say it's going to be this date. I think that would be an insult to the committee as well to do that. So I really want to make sure that we're working together, and I'm not going to prescribe and say at this date we're going to be done. We collectively work together and say this is where we think we're all going to be comfortable. And we'll get there. We'll get there. I can't speak to that, folks.
Let me ask Drew, who's been waiting for a long time, and I've neglected to allow my co-chair to say anything. So,
I agree with what's been said by a number of the past few speakers about the fact that compared to your predecessor, you know, our discussions have been much more, well, friendly, if not, you know, productive, and certainly more congenial anyway. But I'm not an architect, I'm not an urban planner, and I'm not an accountant, but here's my confusion. Having listened to your answers to Andrew Strong and Keith and a number of other people, I think I want to echo some of what Seth just said. 2 years ago, before you had closed on a property, in conversations that we had one-on-one and in groups, you know, you said, when we go, we are going to have to basically sell this campus to the highest bidder and make as much money as we can on this land. It's probably going to be a private developer who's going to put townhomes and apartments or single-family dwellings or something like that, because we need the money to pay for whatever property it is we're going to buy, you know, within 5 miles of our current campus. Turns out you don't need any of that money because your umbrella company has come through and paid for for all intents and purposes, the site that you're going to move to. This evening when Andrew, said, be more specific, please be as transparent as you say you're willing to be with us, and tell us if you need a profit center on this site, and if so, how large, or, give us some specifics. In essence, I'm paraphrasing, but in essence, you said, whatever we put there, and let's say for the sake of argument, it's an ED, a freestanding ED. That freestanding ED is going to need to generate enough profit to cover, as you said, its operating costs. Well, a freestanding ED, even a huge one, might cover a footprint of 1.5 acres, probably way less, but let's say 1 acre. That leaves 15 acres, at least 12 acres of land that doesn't necessarily need to be developed at all. Most of the things that you've said about, I'm looking forward to our discussions, and most of your comments that, are prefaced with, I'm looking forward to our discussions, say basically we have a tabula rasa. We have a blank slate, and the community is going to work with us, or we are going to work with the community to decide what's in the community's best interests. Why not just give the 12 acres that you don't need to cover the operating costs of the freestanding ER to the city, and let the city figure out what's in the city's best interest?
That's a great question. First of all, we still need the money. I mean, I don't want to pretend that because we've made a decision to stay there that we still don't need the $15 to $20 million that potentially that site would have generated by selling it. And there never was. Obviously, there's a lot of discussion about what that possibly could be. Would it be a park? Would it be, money? We still need the money. I mean, no question about it. Again, Adventist Healthcare is a nonprofit organization, and it's extremely expensive to deliver healthcare services, and there's a lot of uninsured people that we have a responsibility to take care of that, requires a tremendous amount of funding. So, I think that the reason we made the decision to hold on to the property, and obviously that was a huge decision, and as we went through that process early on, we were thinking, okay, how are we going to make this work financially? How do we move the entire hospital? And so the decision was made to say, you know what, we probably need to divest of the property. We were communicating that. As we got deeper into the process, we realized that, we need to have health services on this campus. We were listening to the community, and there was a lot of discussion about we need something here. And I think that what we're trying to do, and I realize that it's tough, and it doesn't maybe feel all that great sometimes, but truly trying to figure out working together. I mean, what we don't want to do is be prescriptive and say, yeah, this is what we're going to put here. That's why we want to do it the way that you guys are trying to make it happen. And we go through that process. We may very well say, you know what, we can't afford to do whatever X, Y, or Z. We've got to have that kind of conversation, because somehow, at some point, and I'm being transparent with you folks, if we got to look at the entire financial picture. If we continually operate at a deficit year after year after year, eventually it'll all collapse. I mean, it's like anybody's personal household finances. It's, everybody, we have a budget we have to live within and make it work. We unfortunately don't get free money. And so we've got to have a process where we say, okay, we want to have these services here, and we know that we're going to do the best we can. If we have a shortfall, we try to go after philanthropy, depending on what the particular desire is. We are just beginning that process to work together, to work through that. I know what people want answers right now. They say, I want to know what's going to be there, but it feels to me it sort of defeats the purpose of going through this process. If we said, well, this is what we want there, I think people would say, well, wait a minute, we want to talk about what's going to go there. How does that work? And so I realize, Andrew, there's flaws in this process, and my fear is that if I say anything that's too descriptive to say this is exactly what we want to do, that would be disingenuous for me to do that, because I don't know what we need to do. We need to work together to figure that out. Does it make sense to have an ED there? Sure it does, absolutely. You know, how do we get it done? How do we get the state to say, yeah, it's okay to leave an ED there? There's also going to require us to go back through special exception again. I received an email today from the city saying, you realize that when the hospital moves, you will lose your special exception, which is true. So we got to reapply for another special exception. Yeah, zoning. And so what happens if the community says, no, we don't want to zone it for health care? I mean, that theoretically could happen. You know, Park and Planning will have to get, or the city of Tacoma Park will have to get involved in that. You know, we just want to, we want to, it's very important that we lay ourselves to you and say, look, we need to work through this process. We don't know exactly what we can do and what we can't do. And I want to go through a process that works for you. I want to go through a process that is reasonable and logical, and hopefully, I think what you're doing here with the committee, it makes an awful lot of sense, and I appreciate that.
The image that I have in my mind when you talk about wanting to sit around the table with the community and, you know, figure out what's in the community's best interests, the image I have is you, Rob, other hospital representatives, and members of the community sitting around a table, and you're all in cushy chairs, and we're all sitting on wooden stools. And the reason I'm painting that image is you, the hospital representatives, have a fuller picture than we do. In some ways, us coming up with ideas of what, you know, this site possibly could be used for is a pointless exercise unless we understand what the needs are, you know what the hospital's bottom line is. You've got to generate $10 a year from this site, or you can't, you know, or whatever ideas you throw out, you know, we're just going to put in the trash can as soon as the meeting's over.
You know what? I don't know the answer to that question. I don't. I simply, you know, that's an excellent question. I know what it costs me to operate the hospital today. Every single day of the year, I spend about $700,000 every day to run the hospital. That's what my operating costs are. That's an enormous amount of money. Now, obviously, we're not going to be running a full-service inpatient hospital there, but I still have electricity bills I got to pay, water, gas, trash. I mean, what we'll have to do together is say, okay, here's what the operating costs are to operate the campus. What will it be? What would it cost to operate it with an ED there? Realizing there's going to be revenue coming in, you know, from third-party payers. We're going to have a certain amount of uninsured patients that don't pay anything, and then what other services do we want to deliver out of that location? I don't know today, but what we'll do together is we'll go through that statement, that financial statement, and say, okay, here's what it looks like. Because I really don't know, Andrew. Today I cannot tell you what we need to do to generate. What we know for sure is that it's got to generate revenue, maybe not exactly equal to the expenses. Maybe there's some subsidy that we were able to afford to take on. Maybe, you know, that has to be determined. But at some point we're going to go through that and say, here are the expenses of the services that are being desired. Look at all of it collectively. Let's financially look at this on a pro forma basis, you know, reducing it to kind of the financial terms. It kind of always goes back to that to some extent. Okay, so how does this work? And I think we're going to have to have a transparent discussion. And today I don't know. That's why I can't get into it, because I just simply don't know. I know what my costs are today. I can be very specific what it costs me every day to run the hospital. But that's in today's structure what it looks like. And it will look different in the future, and I don't know what that looks like. We got to model that out.
But until we model it out, any discussions about our wish list, you know, are not.
I think what you do, though, and I think you have a good point there. However, unless we talk about what we want, we won't know how to model it out financially. So if we say we would like to have a health and wellness center there, as an example. And we say, okay, well, that's a great idea. Let's work together. Okay, so it costs this much money for the personnel. It costs, okay, here's what it's going to cost me. So we do need that input. We need you to say, here's that laundry list of things. Otherwise, we're never going to know how it's going to work. And how much space do we have? What needs to be remodeled? We're going to have to do, there's going to have to be major renovation inside the hospital to accommodate some of the things that you may want, or that, that we think that ought to go in there. And so we're going to have to model all that out. So we absolutely, Andrew, need from you, from the community, from the greater community, that list, that laundry list. People are calling it the Christmas wish list, and maybe some of it is, kind of Christmassy feeling, but the reality is we got to get it down. We got to get it down.
With all due respect, probably I think, I could be wrong about this, but I think Fred is the most financially savvy hospital management expert in the room.
We're lucky to have Fred here.
And 6 months ago, we asked you, and you promised us a whole bunch of data on the uncompensated care and a number of other things, and our committee has still yet to receive all of that data. I admit when I walked in this evening, you said you had a package for me, but it has been 6 months, and so while the rhetoric of transparency is very appreciated, the lag time or lack of action that follows up some of those words has been gravely, very disappointing.
I think, Ms. George, didn't we send you a packet of material that you have? That was quite a while ago.
I looked through it. It was not complete. I mean, I believe you sent it in good faith.
I'd love to have you give me a call and you can say what's missing there, because all this stuff is available through the state, all of our financial data. And so whatever you need, and again, if there was something was missing in there, let me know and I'd be happy, because I know that was sent, I don't know how long ago.
About 2 weeks.
No, maybe a little longer than that, but it was a while ago. And clearly, whatever you need related to that data, it's yours. So I apologize if it didn't get to you quick enough, but whatever gaps you have, we're happy to give it to you.
We have about 6 people have raised their hand in the last 10 minutes. So then we'll start with Kathy, who was the first one. And I saw yours, Pat, so now we got 7.
First of all, I wanted to say I appreciate everybody who's here, and I appreciate the work the committee's doing. From my perspective, this is the kind of thing that we were hoping that you would do, is pull together this kind of information and hold these kind of public outreach events. I also want to express my appreciation to Jerry Stocks and the other hospital leadership members who are here. One of the things, particularly in these last questions, that I can sense a lot of concern and a lot of tension about how this process is going to go on. And I just wanted to make one observation. Clearly, there are things that we would like to get from the hospital. I mean, ultimately, we would like them to stay here, but if that's not going to happen, we'd like to see things like a full-service emergency room. We'd like to see other kinds of medical care. But I think this is a two-way street. I think there are things that we can do for the hospital also. They have a very difficult regulatory process that they have to go through to accomplish this move and to make other uses of the site that they've got. And if we can work together on coming up with something that works for the hospital and works for the community, I think we can be of assistance to them also. So I think when people are thinking about this, it's not that we're, it's not a one-way street. It's the kind of discussion where if the community works with the hospital and the hospital works with the community, we can come up with things that are beneficial on both sides. So I think that's where we should be coming from this, and perhaps that will relieve some of the tension. We're not in the position of sort of asking for favors. We have, some things that we can offer to the hospital also as a community. We are very good at getting things, and we're also very good at talking to people at the state and the county level and all of those kinds of things. So I think we should be a bit more optimistic perhaps than some of the recent comments that people have made, and sort of look at this as a opportunity. And I certainly think that the direction that we're going at this point is the right direction. And it's certainly helpful to me to listen to the discussion.
Colleen?
Thanks for coming. I know it's hard to stand in front of her and be pelted with questions. And I know the first time that you and I spoke, we actually talked about the hospital what would happen if it stayed and what would happen if it went. And one of the things that I expressed to you is that I thought as a planner, to me, it was really important to do the planning in concert with the community, particularly the land use planning, that I thought that the residents of the town would feel much more comfortable and much more confident if you were engaged in the process, and before you sold the land, you know, you had buy-in from the community about what you wanted to have happen there. That was when you were talking about selling the land. And now I'm kind of watching you struggle up here, and part of what I'm seeing is a disconnect between the two issues. And one of them is the issue that the committee is charged with, and that is, what are the healthcare needs of the city? And I would suggest that we step back a little bit and just disconnect the land use issues from the healthcare issues. Because I think the list of needs that we need for Tacoma Park are really the most critical thing from my perspective that we could have come out of this process now. And the way that we fulfill those needs won't be limited to the land that is available and the buildings that are available and the capacity of the Adventist hospital to serve those needs. I mean, you're looking at the site that's in the Long Branch area. The city owns a site in the middle of the town at Tacoma Junction that has much better access than the hospital does. I don't know how big it is, but it's going to be available in 5 years. We've got all kinds of activity in the New Hampshire corridor where we've already got almost an office park of you know, medical community. And so I just want to say that I think it's important to kind of disconnect that components, because I think actually in the end that if we're really thinking about it in the physical terms of the hospital land, that we're going to limit ourselves to being able to solve some of the other issues and find a place for places like the birthing center and those activities. And then come back to the issue of the land use constraints. You know, it is zoned for residential housing. As a city council member who's working on the budget this month, you know, I'm also really in tune to the fact that we have a lot of land in the city that's exempt from paying taxes, and that there's burdens on that. And that's an issue that I think that the community needs to look at too when we look at different reuse configurations and what they are and how they operate. So that's my 2 cents.
Fred? You going to pass? Keith? And I'm going to just ask people to keep their comments very short now because we lost our co-chair over this. And no, just kidding. He's sick and has a baby at home.
I'm taking seconds. I'll take a small portion. I wanted to respond to 2 things. One was I wanted to say personally, I'm actually somewhat relieved, Jerry, that you're not walking in here tonight with all the answers. That would fly very much in the face of the critique that I leveled about the past of unilateralism. So I would not have wanted you to walk in and present us with the complete vision of what it must be. The other thing is that following up on Drew's questioning about the finances of the land, I think there's one question that you ought to be able to answer clearly now or very quickly, and that is, do you need the campus in Tacoma Park to subsidize the move or the operations of the hospital on Route 29? Because I understand, let me just clarify, I understand that for the campus itself, it obviously has to, one way or another, be financially self-sustaining for whatever operations are envisioned there. But we need to know, are you looking, especially now that you've decided not to sell that land, are you looking for it to subsidize the move or what you do in the new hospital?
Again, Keith, good question. And it's certain, the way we look at things here, clearly you want every entity and activity to be self-sustaining. That's the ideal situation. Is there cross subsidies that go on? Yeah, there are. I mean, the reality is, do you need the cross subsidies?
Do you need this campus to subsidize the hospital?
You mean the
To
sale of the land?
To sell the land?
Either, do you need it to be cash flow positive? Exactly. Do you need it to be anything other than cash flow neutral?
The reality is, looking at it purely from a financial standpoint, we would be better off not to do anything there. But that's not in the best interest of the community to do that. I mean, we would be better off to say, you know what, let's not operate anything there. Let's concentrate all the activity at one location. It'll be a challenge financially to operate this facility. The commitment will be there. It's not going to be a flash in the pan commitment. It's going to happen. It's been there for 100 years, and it's going to be there another 100 years operating. But it clearly is, this is not going to be a moneymaker where it's subsidizing other operations. And hopefully, Keith, does that give you a...
That's exactly the answer I was looking for. It's very helpful. Thank you, Jerry.
Sure, Keith.
Andrew?
It looks like Keith and I are going to change positions here. Maybe this is a comment more for the city and for the mayor and Colleen Clay, who are urging us to sort of ask not what the hospital can do for us, but what we can do for the hospital. And to separate out land use questions from healthcare questions. Maybe I should come clean here. Part of what I do professionally now is work for the law firm that Sensible Growth hired to help us with the hospital issue, because I got an education from that process. There's a question of leverage here, and for anybody who just heard the answer we just heard, who wants health care on this site, should listen really carefully to this. The hospital would rather move and not operate a hospital on this site financially. The only way that that is not going to happen is if we extract a binding promise that we have health care on this site before the state and the county sign off on that certificate of need. If they get that, they've got the keys to the car, and they're heading up 29. Bank on it. Bank on it. If you want health services here, there has to be a mutual understanding, mutual agreement between the community, the city government, and the hospital to work together to ensure that those health services will be in place in exchange for our support for the land use regulations they need, for the certificate of need that they need, and then they can have the new hospital and we can have it too. That is the only way. If you abandon that approach and give them that support without that promise binding, you will be left hitchhiking up 29 because Metro won't take you there. You'll not have your health care. Don't sell yourselves out.
Pat, you had a comment?
Yeah, one question.
Seth's going to bring you the mic.
Yeah, my name's Pat Lovelace. I got a question. There's two questions. One, why can't they find another nonprofit entity that is willing to run a small community hospital there so that Tacoma Park can still have the hospital? Question number two, if you do move and you guys decide to leave that site, are you planning on saddling Tacoma Park with the cost of the demolition and the cost of securing the facility to keep crime out of it? Or are you guys going to pay for some of the rehab of the facility and securing the abandoned facility? Because you know gangs, drugs, and everything else, and every 10 different shades of vagrants are going to be in that building. And since it's a large area, it's going to cost a lot of our police force to clean it up. And I'm wondering, are you going to help prevent that from happening? And are you going to agree not to saddle Tacoma Park with the cost of that? But we'd prefer to see it kept as a hospital. And also, come on over to Franklin Apartments. I live there too. And you will actually meet some of the people who depend on that hospital. Thank you.
Thank you for your questions, Pat, and I look forward to coming and visiting at Franklin. We talked about that a little bit earlier. Certainly, in terms of operating another hospital, the state would not allow that. And, you know, that's actually in a different planning district, the county. It goes by county. But from a regulatory standpoint, that would be very difficult to achieve. I think the other question you had is, you know, the assumption is that there will be vibrant activity there and that the city will not be burdened with the things you had described. So I look forward to having some discussion with you, Pat, and visiting you over in where you live. Look forward to that. Thanks for your question.
we got 2 more people, and I see Rob looking at his watch over here, so we do want to, I looked at mine too. Wrap it up soon. I'm going to have Amy before Larissa, because Amy hasn't spoken yet.
All right. I'm Amy Polk, also with the Birth Options Alliance, and I just wanted to make a comment about, we've been talking a lot about money. A freestanding birth center staffed by midwives would not be a money pit, but would actually be the opposite if it was partnered with a nonprofit organization that could take donations. And the reason I say this is because, Jerry, you mentioned that you were distressed about the closings of the Tacoma Women's Health Center and also the Maternity Center. There are thousands of women and also men in this area who are more than distressed by the closings of these facilities. I call ourselves like the Maternity Center alumni, who are more than distressed, are really horrified that the options that we had in the 30 years to say of the Maternity Center's operations are no longer going to be available to other women. These people are believers in alternative and out-of-hospital births and midwife-assisted births, and they are willing to give their time and their money and their talent to operating something like a nonprofit birth center, say at the Tacoma, the WA campus. They're willing to open their hearts and they're willing to open their checkbook. Larissa's got people waiting to donate a lot of money. She can tell you how much. Like waiting with checks to say, this is how much I'm going to send you, tell me where to send it and what it's going to go for. So there's a lot of support for that, a lot of financial support for that. So if WA was to establish or partner with a nonprofit freestanding birth center on the campus, it would be self-sustaining and even more so.
Amy, is that right?
Yeah.
Amy? I think that it's clearly on the list right now, this whole idea of the birthing center. I think it has, I think we need to, I think it's an interesting idea.
And I'm going to ask Amy and Larissa, if you have any written information and some of the stuff that Mari talked about to pass their way, that would be helpful. One last thing, Larissa, and then we're going to wrap it up.
Hi, Jerry. This is a question as a Tacoma Park resident and also as a former employee of Holy Cross. I worked there for 5.5 years during their entire construction and expansion project. And one of the things I'm wondering, for the sake of not just the people here, but the folks who might be watching this later, is how are you going to liaise with the community about this in an accessible way? I have it on good authority that you're a hard man to get in touch with. And so I'm hopeful that we will have a more accessible route, knowing that you have a hospital to run in addition to this issue to deal with. And so I'm wondering if you're going to appoint or assign one of your current executives or a new executive, perhaps even at a vice president level, who would be responsible for dealing with the expansion and transition with the Tacoma Park campus.
You're speaking of Tacoma Park specifically, not the...
Well, I would imagine that this would be a job that would encompass the general changes. I would leave that to you to assign the duties, but somebody with whom you could say, if you have questions, if you have issues, you may go to this person's office, you may call this person on the phone. This is my executive who is tasked by me, reporting directly to me, who will be responsible for this. In my experience at Holy Cross, I found that was a really, I'll give you this hint because I'm sure Kevin's not going to sit down and give you a chat about how he made it go so well. But that having that point person, both for the community and for the staff, was a very helpful.
Yeah, I know you're right. It's hard to be in 10 places at once, as you well know, and I struggle with that every single day. But Jeff Morgan, who has actually been with the hospital for 25 years, he's a vice president, and he's actually responsible for primarily working on the new campus piece, but also is very heavily involved in how we're going to reuse the facilities. And so, what I would suggest that you do, if you ever want to get a hold of me, I mean, we can always call the office and say, I need to speak with Jerry. And when people do that, I try to respond quickly to that. Jeff is also, I mean, we're basically interchangeable.
What's Jeff's title?
Jeff is, he's vice president for expanded access.
Okay.
And, which is he's got a lot of responsibility, but also
It sounds a lot like other duties as assigned.
He's very heavily involved in both sides of this equation right now. And again, Jeff is one person I realize, but I think you're absolutely right that we've got to have accessibility. And please, if you want to talk to me, Dottie, my assistant's been there for 25 years, and she's excellent. She says, if you say, I need to talk to Jerry, she is very good about getting messages in front of me. And, you know, because this is important stuff here. And again, if there's any issue, you know, I can't return the call immediately. You know, Jeff, we'll try to get Jeff involved. Again, Jeff has got much more knowledge than I have. I mean, he's been here literally 25 years, knows a lot of the folks in this room, actually, and, you know, a very dedicated servant to getting this done. So,
What Jerry didn't want to really tell you is that Dottie really runs the show over there.
Dottie runs the hospital.
It's really not
I'm sure she does.
getting in
Yes,
touch
she
with
does.
Jerry, it's getting in touch with Donnie.
Dottie is the key.
I want to
She
try
knows
to
that.
wrap up a few things here, and also Drew Summers apologized to everybody here, and specifically to you, Jerry, that he did have to take off a few minutes ago. And I also want to add one thing that hasn't come up here today that Jerry hasn't mentioned, but that is as a result of a Blue Ribbon panel on health disparities at the Adventist Hospital formed. Many suggestions from members of that panel, which I was on, have come to fruition, including the hiring of somebody whose job is specifically to look at issues of cultural competency, access to care. I don't know what Marcos's real title is. I mean,
Marcos Pasquero, he is the Executive Director of the Center on Health Disparities for Adventist Healthcare.
And so that's another area that didn't come up here today, but it's something that Adventist has looked at because, as somebody in the room tonight said, that many of the people who don't have access to health care are also the people who aren't here tonight. And so I think it's important to bring up that they've looked at access issue and what are the barriers to access, including transportation, language, what may turn somebody off to Washington Adventist and have them go someplace else if they feel that they were treated poorly or their religion or health belief system wasn't recognized, and so that's something Adventist is looking at. A lot of stuff has come out of here tonight, and I can't sum it all up, but I'm going to try really quickly, and that's leaving some kind of emergency system in place that's looking into the possibility of having birthing options, including a freestanding birth center, where the point has been made that that may support itself economically because the need is there. Having another community meeting at the Franklin Apartments on the fourth Tuesday of a month. Thursday. I wrote down Thursday. I read Tuesday. Looking at the issues, whatever happens at that site, the environmental impact to the creek, to the park, needs to be taken into account. Being very clear on what are the financial resources that Washington Adventist has to leave in the community, what before putting together our Christmas list, we need to know how much money Mom and Dad have to spend this year. And so getting a really clear idea of what kind of money we're talking about, or at least a projection of what are the needs of putting what we want there and figuring out a way to work together. I'm sure I missed a few things, but I think those were the highlights. The other thing is that the Health Services Impact Committee is about 7 people right now. I think our mandate is that we can have up to 12 people, 10 to 12? Or Vanita might be. 15? 12 to 15. We have had some attrition. People have moved out of the area. People have had other commitments. So I do invite anybody in this room or anybody who's not here, and we really want people who have the diversity of Tacoma Park, and I use the word diversity very, very loosely, to be on the committee. You don't have to be a healthcare professional. You just have to be a human being who needs healthcare, which is all of us. So if anybody's specifically interested in applying to be on the committee, they can talk to Vanita, right? And I think that wraps up. Vanita has all of your contact information, so when we have other community meetings, this is one of many. We will definitely spread the word, and when we really encourage people to help us get this survey out. If you have friends who don't like surveys, encourage them to do that. If you have friends who don't speak or read the language that the survey's in, try to see if you can help them fill it out, because the more information we generate, the more we'll know what the needs are in Tacoma Park. And I wanted to thank Rob and Jeff and Jerry for spending the evening with us, and Vanita for doing all the groundwork.